It's amazing how many people that are in a terminal situation can reverse it if they take control of their own, issues. More people should do it. But we give it all up to MDs, the right prescriptions for drugs from drug companies that own them. Let's examine ferritin and hepatitis C. Most people with hepatitis C can ask their doctor for a ferritin test, and the doctor is going to tell them, you don't need this test, it's not necessary. Ferritin can be the cause of all of the symptoms that many people have. About 30% of males with hepatitis C and about 30 to 33% of postmenopausal females with hepatitis C will have a high ferritin level, and about 8% of premenopausal females. Ferritin is iron storage in the liver, in part. It also has some relationship to inflammation and a few other things. High ferritin levels will raise your ALT, your AST. They can raise your alpha-fetoprotein level, which is a tumor marker for primary liver cancer. And they will make you feel uncomfortable, fatigued, chronic fatigued, nauseous, and in many cases, lowering the ferritin level in these people can remove all these symptoms, and one can live a normal life. And in most cases, these people are pushed into interferon use, when a simple phlebotomy or the use of IP6, which is a capsule, some rice bran, that lowers the ferritin level. And when you lower your ferritin level, you'll feel the symptoms disappear. You'll see your lab work return to normal. And it's a common problem. 50% of the people in the United States that develop cancers have high ferritin levels. People who have high ferritin levels for years develop many different types of cancer. It is important not to take any iron supplements. Many multivitamins have iron in them, and those should be avoided. People with hepatitis C, for the most part, it's very rare that any of them need any iron, so avoid iron supplements and get your ferritin checked at least once a year. The doctors will keep telling you it isn't necessary. Get it. If it's high, get it lowered. I realize some people have insurance. I don't, so I just tell my doctor what I want. And if your insurance doesn't cover it, pay for it. It's worth it. A few years ago it was 20 bucks. Today it's about 85. I know I just had one, so it's more than important. In hepatitis C, it can be the one item that's between you and your health, between sickness and health. If you don't feel good, the ferritin is often the cause. Probably a third of the emails I get almost every day are people who have a high ferritin level, and doctors often won't write a prescription for a phlebotomy, which is taking out a pint of blood at a time, or a unit of blood. This is that draws the iron out of the liver, and depending on your age and your condition, etc., it can take 5 to 10 phlebotomies to lower your ferritin, depending on how high it is, of course. So if your platelets are low, which would be in advanced hepatitis C or cirrhosis, they won't prescribe them. That's one reason they won't prescribe phlebotomy. The other reason is because most doctors don't have malpractice insurance for prescribing phlebotomies, so they won't write it. People won't recover. It just doesn't go away by itself. It's something you have to lower through phlebotomy or IP6. It's important to have it go down. It's important to know what it is. And if you ever discover that you have a high ferritin level, you should get checked for it every 6 months. It's a simple blood test. And if your doctor doesn't want to prescribe that blood test, tell him to or her to. And if they don't want to do it, go somewhere else. It's important to know what your ferritin level is in the management of liver disease. In good health, Lloyd Wright.